I'm joined now by Sarah Coghlan, who is Global Director of Men's Health Promotion at Movember. Sarah, so good to see you. You've been with Movember right since its very beginning. What is the charity's overall aim?
Thanks for having us, Simon. The charity's overall aim is really to change the face of men's health. We want men to live healthier, happier, longer lives, and we do that by investing in 4 critical areas: prostate cancer, testicular cancer, mental health and suicide prevention, and by getting men to change their appearance. We're ultimately aiming to change that outcome of longer, healthier, happier lives.
And the work you've done has just been remarkable. I understand you have the top 5 things a man should know and do. What exactly are those top 5 things?
Well, there are many things men should know and do, but I think when it comes to their health, if men want to know a little bit about what they could do to slightly improve their health outcomes, there are 5 things that we've got evidence around that ultimately change those outcomes. One being, know your numbers. Know your family history, understand what your dad died of or has been diagnosed with, what your grandfather, what's that family history, and understand the link. Know your numbers. Definitely know your nuts. So you spend a lot of time, boys, with your hands down your pants while you're there. In the shower in the morning, know what your normal is. And if you notice change, if you find a lump, if you find a shape difference, if there's pain where there wasn't pain before, talk to a doctor. Testicular cancer is still the #1 cancer killing young men. However, it's incredibly highly treatable and has very high success rates. So have that conversation if you notice change. Number 3, spend time with people who make you feel good. One of the greatest predictors of a long and healthy and happy life is the social connections that you have, the depth and quality of friendship, the time spent with others. So it is good for your health to spend time with your friends, to spend time with people who make you feel good and stay socially connected and value that connection. Talking more is the big one. The idea of talking more about everything. Life has good and bad in it. Life has ups and downs and challenges and moments of great victory. And to be able to talk more, to get men to have those honest, open and vulnerable conversations is a really important part of health and long life. And then finally, move. Exercise has proven to be that halo behaviour that if you are more regularly moving, and I'm not talking, needing to go to the gym and having a 6-pack, I'm just talking more exercise in your day, you're more likely to reduce your alcohol intake, less likely to smoke, you'll eat a bit healthier, and your mental health will be improved.
And Sarah, the stats are alarming when it comes to men. Men dying on average 4.5 years earlier than women. 3/4 of suicides in the UK are by men. How on earth do we go about changing those stats?
So there is lots we can all do, and I think we all have a responsibility here to really address some of these. Suicide is the #1 way for a middle years man in this country to die. 13 men every day in this country will take their life, and I think we all have a role to play in that. And then there's the structures sitting around men. Men are not served well by some of the structures in society. So we've got individual change that we're asking men to make, but that only goes so far without structural change. We need healthcare systems that better understand men and design for men. We need workplaces that give men permission to sort of turn up in all their forms. Workplaces that allow men to actively and equally take parental leave. To be an active parent is going to have a really long-term positive impact on a man's life. And then finally, the norms that sit around men, and which we all contribute to, and media is a big part of that. How do we create norms that see men turning up differently? How do we create a world where young men can play out what it is to be a man, to be vulnerable, to show strength in taking action when he notices change in someone else or himself? How do we shape that? How do we present that and start to all be part of that? Because it's that system that sits around men as well that sort of holds the problem in place.
And in terms of men's health, both physically and mentally, how have you seen the landscape change during your time with Movember?
A lot. I notice it in workplaces that invite Movember in to talk about men's health, and where 10 years ago it was mostly women who turned up to those talks, who cared about the men in their lives. Now we're seeing more like 50-50 men turning up, senior managers and executives sitting on panels with me and talking about when they went through a tough time and what they did about it, how they built their resilience or how they overcame their own mental health challenges. I think these are really important steps towards change. I'm really proud of the work we've managed to fund and the change we've generated, as well as the community. 5-6 million men have joined us on this journey around the world, and each one of them changes his appearance, grows a moustache, has to tell tell someone why he's doing it, and in doing so, starts that change, starts that conversation that's really important.
I mean, it has been an extraordinary story. You touched on it there. Movember is now known globally, but there is a lot more to it than just growing a moustache at the end of the year, isn't there?
Yeah, I don't tend to grow a moustache every November. So there is a lot more to it. I think we operate year-round, running the programs that we're generously funded to operate mental health and prostate cancer and testicular cancer. We turn up throughout the year with other activities for our community to be part of, as well as sort of feeding out health promotion messaging and making sure we're really dialing up that awareness and education, because if men have the information, if they have the tools and resources, and those around men do as well, we can start to practice some of these things. We can practice what it's like to be open and vulnerable with a friend because someone's undertaken that exercise and learnt from the tools and resources we're creating. So, yeah, we are very busy, although people sometimes still ask me, what do you do with the rest of the year, Sarah? But I can promise you we are very busy trying to change the face of men's health.
It is far, far more than that. Sarah Coghlan, Global Director of Men's Health Promotion at Movember. Thanks ever so much for being with us.
Thank you, Simon.